Good morning, everyone, and thank you again for joining us for our desktop discussions. We are here each Tuesday at 10 a.m. Eastern Time to answer your questions related to the current pandemic, COVID-19. My name is Casey Hope. I'm Marketing Manager at Medcom Benefit Solutions, and I am joined today, and as always, by Michelle Barkey, our Senior Legal Counsel at Medcom. Good morning, Michelle.
Good morning, Casey.
All right, are you ready to get started?
I am.
All right, here we go. We have just a few questions this morning, so we'll try to cover those as in depth, but as quickly as possible. We all know that everyone has a lot of things on their plate currently. So our first question for calendar year FSA plans. This one is about the grace period, not the rollover. If the grace period ends March 15th, the employer may decide to extend the period in which the employee has to incur claims and apply to the prior plan year through December 31st. Is that correct? For example, the 2019 plan year grace period ends March 15th of 2020. With the new regulations, the employer can allow the employee to incur claims through December 31st of 2020 and apply these claims to the 2019 FSA balance. Is that correct, Michelle?
It is absolutely correct. If the plan so desires, they can allow the grace period to be extended to 12/36/2020.
Excellent. Thank you for that clarification. Our next question today. So we have a client who's using Medcom as an FSA administrator. So we have an FSA active from June 1st of 2019 through May 31st of 2020. The client has amounts to use but doesn't want to sign up for the 2020 plan. Do the COVID-19 updates allow this person to still use their 2019 through 2020 funds up through December 31st of 2020?
This is also a really good question. And yes, if the employer amends the plan to allow for this, it does not specify that an employee has to be currently enrolled in the current plan year in order to benefit from this in the previous plan year. This is what the IRS actually states in Notice 220 or 2020-29. The IRS said, this notice also provides flexibility for a 125 cafeteria plan to provide an extended period to apply unused amounts remaining in a health FSA or dependent care assistance program to pay or reimburse medical care expenses or dependent care expenses. Specifically, an employer, in its discretion, may amend one or more of its Section 125 plans to permit employees to apply unused amounts remaining in a health FSA or dependent care assistance program as of the end of the grace period in 2020 or a plan year ending in 2020 to pay or reimburse expenses incurred in the same qualified benefit through December 31st, 2020. They never mentioned that you had to be currently enrolled in the next year plan. Therefore, if the plan wants to amend the cafeteria plan to allow for this, it is certainly permissible.
Excellent. Thank you, Michelle. If we have a special enrollment request during the outbreak period, when would the enrollment be effective? Would it be based on the original event date or the date of the request?
This is a really good question. And the HIPAA special enrollment requires retroactive enrollment for birth, adoptions, or placement for adoptions. This is no different with the outbreak period. The Federal Register did provide an example on this when they actually talked about the outbreak period. The scenario they provided was as follows. An individual is eligible for, but previously declined participation in her employer-sponsored health plan. On March 31st, 2020, the individual gave birth and would like to enroll herself and the child into her employer's plan. However, open enrollment does not begin until November 15th. When may the individual exercise a special enrollment right? And the conclusion was the outbreak period is disregarded for purposes of determining the individual special enrollment period, and she and the child may qualify for the special enrollment into her plan as early as the date of the plan of the child's birth, which goes back to March. So therefore, she can certainly do that. However, HIPAA also says that for each other special enrollment event, plans are only required to provide coverage the first of the month following notification. Therefore, with the first of the month following notification, and you can see this in the USC code on this, which therefore, for those outside of childbirth, it would be the next of the month after they were notified, unless we get further guidance on this. So I would always check with your carrier to make sure that they also agree with this. But right now, only for childbirth would you go back. Everything for childbirth, adoption, or anything to do with the baby, go back. Everything else, it would be the first of the month following.
Thank you, Michelle. We also, Michelle has provided a link that kind of goes into some of the things that she was just talking about. We will have that included in the questions and answers when we send this out today. So just to let you know to watch for that link on this question today. Our next question, the plan year ends on March 31st, 2020. We have a 90-day run out that ends June 30th, 2020. We do not want to extend the run out to December. What do we have to do?
Well, it depends on whether or not the outbreak period and the 60 days following the outbreak period, the outbreak period ends. We don't know when that's going to happen at this time. But basically, the run-out would not begin until after the outbreak period, which is 60 days following the end of the national emergency. National emergency hasn't ended at this time, so we don't know when that run-out is going to start. But after the outbreak period, you would start your 90 days. There's a chance this could go into December. I don't think it will, but at this stage of the game, with the run-out, you have no choice but to allow the run-out to commence after the outbreak period.
Okay, that makes sense. Thank you, Michelle. That was all of our questions that we have for today. I just want to go ahead and put this out there. Michelle and I have been working, as you guys know, a lot of you attend our desktop discussions every week. We appreciate you being here. We appreciate your time and the questions that you've each submitted. You guys have also probably been on a lot of our update webinars, the coronavirus and how it's affected COBRA, how it's affected FSAs and DCAP accounts. Just wanted to let you know we are providing some opportunity for training, for specific customizable tailored training. I'm going to send out a link with this question and answer this afternoon for our webinar today at 2 o'clock to give you a little bit more information about how you can learn more and how we can help you even more than we're trying to help you now. Thank goodness for Michelle. She is a wealth of knowledge and has been a huge guiding force for us and hopefully for you as well. So we're going to make it a bigger opportunity for you guys to kind of benefit from her knowledge as well. So we'll send out that information today. The webinar is today at 2 o'clock. You can also find the information on our LinkedIn. It's AdMedCom Benefits on LinkedIn, and register for that webinar. Michelle, thank you again so much for being here today. We appreciate your time and your expertise.
And thank you, Casey, for your great job as usual emceeing.
Absolutely. Everyone have a wonderful day, and we will be back here again next week, 10 o'clock Eastern Time.